Hello, my name is Roland Poku, FMP student, um, Youngstown State University. In this post, I share some ideas about stroke and stroke recurrence, uh, barriers to antithrombotic, antihypertensives, and the other medications out there that can help prevent stroke in the first place, and even help those who already had a stroke so they don't get another one. These medications are very critical when it comes to managing the disease. So in this poster, I try to explain um, some of the barriers when it comes to these medications. Now, by way of introduction, I'd like to mention the two types of stroke, which is a ischemic stroke, which is a blockage of blood flow to the brain, and hemorrhagic stroke, which is basically a rupture of oxygenated blood in the vessels in the brain. Stroke risk factors. Some of the main risk factors include uncontrolled hypertension, previous stroke, somebody with a history of stroke, smoking, um, and obesity. It must also be mentioned that people that have a history of AFib, if it's not well managed with some of these thrombolytics, can lead to stroke as well. Some of the antithrombotic medications and how they work has been listed in this slide as well. They prevent blood clots and change the blood so that the blood can flow through the vessels and will not lead to stroke. Some of the medications include Eliquis, Xarelto, warfarin, Plavix, aspirin. These antithrombotics that includes like platelet medications and all that. They like Plavix and aspirin. They all help with the blood flow. The common antihypertensives, I also mentioned here like calcium channel blockers, beta blockers, ACE inhibitors, ARBs, diuretics, and others. These all, if they are here to, can prevent stroke. So some of the leading health institutions that we know kind of give us some data and statistics about how stroke affects the population. They include CDC, AHA, and World Stroke Organization. And from what I um, collected from these sources, they said that there are over 12.2 million new strokes each year globally. 1 in 4 people over the age of 25 will have stroke in their lifetime. Um, every year, about 75,000 Americans will have a stroke. It will be their first time, and 23% of those will suffer a second stroke. Um, about 610 of these are first or new strokes, and about 185,000 strokes, nearly 1 in 4 people who have had a previous stroke. And my question is, something to look at is this is preventable. If somebody's had a stroke before, unless there are other comorbidities that make them very vulnerable to getting another stroke. Basically, people are well managed when they have the first one, and they follow the medication therapy, and they adhere to all the instructions and the protocols to follow. Um, there will not be too many of those who have a second one. And I just put this as a block of slide how to manage stroke here because some of these medications have already been mentioned, but I just thought that I should put it here so we can plainly see where the mode of action. The anticoagulants, which include vitamin K antagonist, warfarin, factor 11 inhibitors, Eliquis, Xarelto. The antiplatelets include Plavix and aspirin, and that, as we know, the antihypertensives, they are all listed there. Now, we exploring further, we can see the challenges when it comes to managing stroke. It's not just the medications, but also, just having the people having education about some of the things to look for, or if they have the certain diseases like diabetes or hypertension, or if they have high cholesterol, why, how these things, if it's not managed, if they don't control the disease with the medications, with the direction from the providers, what can happen to them. So some of the challenges exist where people don't really know what to do, even when they are around somebody who's having a stroke. You know, I have in my some of my research throughout this in this course had mentioned earlier that we should probably make it a duty to just have some of these brochures available in places where of public patronage, like in libraries and other public places, so people can just grab them and read about them. Because if people are aware of certain things in their lives that, or even family members, if when they experience a stroke, people are not aware of it. So if people know about BFAST, you know, things about their balance and eye movement and their feet and some just basically some basic things that people need to know, so they can report it or call 911 and just help intervene when people are going to stroke. I just felt it was very important that I put that up there so we can actually have that in this slide. Now there's research out there. I looked at a few ones, and there's one here, Cornish and Sagres. They talk about barriers to medication adherence. Cornish had this cross-sectional study that looked at medication adherence, which was measured, and you looked at the barriers that are out there. The barriers that was found in this research include the age, race, and ethnicity, income, finances, comorbidities, alongside lifestyle interventions. The main concern that the study found was uh, people were concerned about the effects of the medications and the dependence, and then also perceived discrimination that they think they have when it comes to navigating the healthcare system. These all like phrase unnecessary, undue barriers that make people reluctant to take medications that are life-saving uh, because they are not educated and because they don't understand how devastating the disease can be. Another study that I looked at was Daly uh, and in 2021, they took a look at some medications, antihypertensive, statins, and um, antithrombotics, and they research concluded that these medications, if they adhere to, contributed to reducing the mortality rate, which demonstrates the effectiveness of the antithrombotics and the antihypertensive and others if people really adhere to them. So in conclusion, um, I've found that the adherence of anticoagulation therapy, especially, is as a preventative force against stroke and stroke recurrence. Most of the literature reviewed did not produce results that affirm adherence of anticoagulation alone as a sure way to prevent stroke recurrence. Authors did not necessarily discount the effectiveness of anticoagulation on others in the prevention and management of stroke. Instead, they recommend further research into whether anticoagulation non-adherence has optimal effect and recurrence of stroke. In other words, they can't conclusively uh, prove that anticoagulation medication, not adherence alone, lead to stroke and stroke recurrence. But research out there is not conclusive, so it encourages more research into the subject and to make it conclusive, so that we can actually boldly promote the use of the medications when we prescribe them to the patients. Dyslipidemia, diabetes mellitus, hypertension, they represent common and important modifiable cardiovascular risk factors among patients with stroke. All these things can be modified. Lifestyle changes and eating habits, or if people take them more seriously, it can help prevent them from having stroke, especially those who had stroke before. Uh, they, they will not have another one. I thought this was a very interesting subject, and I just wanted to pick on it and research and expatiate it for us to discuss. Thank you for listening.